Very well, it's now time for your health segment, and our focus of discussion is universal health coverage. President Uhuru Kenyatta this Thursday is expected in Kisumu, where he will officially launch the pilot program. And of course, the government has said it expects that by 2022, it will have fully rolled out universal health coverage. How tenable is this? For details of this, we are now joined by Dr.Samson Mahugu, who is the head of health promotion at the Ministry of Health, who will give us more insights. Thank you very much, Dr. for joining us this evening.
Thank you for having me, Catherine.
All right, let's talk about the much talked about launch on Thursday, universal health coverage. What should we expect to see on Thursday?
First of all, I'd like to just take a step back and really define what universal health coverage is. When you talk about universal health coverage, we're talking about a situation where a population is able to access quality health services at an affordable price, or that are affordable and that are easily available or are conveniently available to them.
So access at an affordable cost or no cost at all?
Yes, it can be either of the two. The president will tell us in which direction we are going or we are heading on Thursday. So I'll leave that for him to announce.
So when we say he's launching the pilot program, what does it entail, this pilot program?
Yes, so as you're all well aware, Kenya is comprised of 47 counties. And because we want to have a seamless implementation or successful implementation of universal health coverage initiative, it will not be possible to have all 47 counties really rolling it out all at the same time. Because there would be a bit of confusion, because you'd find different counties will have a different understanding or perspective of how really or what is expected of universal health coverage. But what we've decided to do, the approach we've decided to take, is to have 4 counties that really have the main issues that are of greatest concern to us as the government, Ministry of Health, as the health sector. And these are particularly road traffic accidents, where we see a high prevalence in Machakos. Non-communicable diseases, we have a lot of them in Nyeri. Communicable diseases, we have a lot of them in Kisumu. And we also have the pastoralist populations who have their own unique issues because of the nomadic nature in which we have the populations in those countries existing.
So which is the 4th county? Because you mentioned Nyeri, Kisumu, Machakos, and
Isiolo.
So those are the 4 counties.
Correct.
So that is how you arrived at the decision to pilot in these 4.
The 4 counties are a good representation of the other 43 counties. So it will be very easy for us to learn lessons from these 4 that will be able to apply to the other counties that are closely related to them.
Is there a particular time frame in which you're doing this pilot program in these 4 counties?
For us, let me say we're not restricting ourselves to any time frame. Our real intention really is to have the rollout happen as early as possible. But we would like really to have an evidence-based perspective in terms of how we are going to roll this out. We don't want to do things, if you like, in a Juakali fashion or in a pedestrian fashion. We want really to learn our lessons, document them, really reflect upon them, and that way we'll be able to really have a very good background or foundation upon which we'll be able to have a sustainable universal health cover scheme in Kenya.
Of course, for the common mwananchi, the question is what new services will they access, maybe cheaply or for free, with the launch of this UHC? Okay,
there are quite a number of services that are going to be available through this universal health coverage. The first thing is the approach that we're having. We are having a bottom-up approach. Traditionally, in Kenya and many developing countries, we've always tended to focus a lot on the hospitals, the kind of services that can be offered from hospitals. But basically here what we're saying is that we are starting our focus from our community level health services, where we have our community health volunteers, or the village doctors, as they're referred to in some communities or some counties. And their main role really is health education. Majority of Kenyans are healthy, and we would like to keep them healthy. And that is the one way, and the foundation upon which most countries that have been able to enjoy success of universal health coverage have been able to really be able to realize the success by ensuring that there is proper health education of communities on how to remain healthy. Secondly, we have the primary healthcare facilities, the dispensaries and health centers, where we will have the people who we will really encourage to get screened so that we can be able to find out whether they have or are ailing from diseases such as cancer, heart disease, hypertension, diseases that really they can prevent or can detect at an early stage. They will be able to detect them at that early stage within the facilities at those primary healthcare levels. Should you find that you are actually now suffering, you are actually exhibiting or showing the symptoms,
yes.
Now you'll be referred to the higher centers, which are the sub-county and county hospitals. And within those hospitals, you're also going to have the emergency healthcare services. So you'll be able to actually have transport from those facilities, the primary healthcare facilities, to the secondary healthcare facilities, the sub-county and county hospitals.
So the next question would become, do we have, the personnel? Are you planning to increase personnel? Because we always keep talking about lack of, doctors, lack of nurses at that particular level. So in terms of preparedness, what is there? Yes,
indeed, we are fully prepared. All that has been put into place. We have planned and are striving towards achieving the required ratios of doctor to population ratios, the number of doctors that are meant to cover specific populations, the number of nurses that are meant to cover specific populations. In terms of even the nomadic populations that we're talking about, like in Isiolo and Northeastern and those areas, we're even going to talk about outreach facilities, where we're going to have our health facilities, our health workers reach out or travel out to reach out to those populations that are nomadic with services such as vaccination, where they are required.
In terms of public-private partnerships, to what extent are you engaging them to try and roll out this particular program?
Actually, I would like to say, first of all, that we are very, very thankful because of the kind of reception that we've gotten from the private sector. We have really been able to drum up a lot of support from various partners to reach this point that we've been able to actually really say we can actually launch comfortably, confidently on Thursday through the support of the private sector and the traditional partners such as the UN agencies. In fact, we're going to have the head of the World Health Organization joining us on Thursday together with the president during the launch. So there's really a lot of concerted effort from private and the traditional partners with a view to making sure that universal coverage is a reality in Kenya.
Within this, 4 years, because we're talking about rolling this out by 2022 fully, do you think we'll have the capacity and be able to achieve this? I know you're likely to say yes, but in terms of the practicality, what are the measures that perhaps you think you have already put in place to ensure that you get there?
And that is why I have really emphasized on the point of us really approaching this from an evidence-based perspective. We are not going to move from one phase to the next without really having seriously interrogated the strengths, weaknesses, or opportunities and threats that exist within the various aspects of the rollout. Because we're not really targeting universal health coverage as a short-term or an issue that we will be roll out during the tenure of the current president, His Excellency Uhuru Muigai Kenyatta. But we are envisioning this to be something that will actually be an enduring initiative for decades and centuries to come, if you like.
So you're looking at the sustainability bit
Exactly.
of it. All right. Yeah, you talked about some of the services that will now be available. Can you perhaps break it down to inpatient and outpatient services that will be available for those who will be seeking treatment?
Let me say, basically, I might not be able to say too much before the president is able to. You
don't want to let the cat out of the bag.
I don't. The president really has a lot in store for Kenyans. And I really don't want to steal the thunder from him. But what I can promise is that we can expect quality health services, we can expect affordable health services, and that services that are easily or conveniently available to the ordinary mwananchi up to the grassroots levels. And some of these services you'll find actually not available in within the other sectors of health within Kenya. So it's something that we should be looking forward to. Thursday is something I'm actually
you're very excited
about. Yeah.
All right. Most of the time we are accused of focusing so much on the treatment. We rarely talk about the prevention, and especially now when you're telling us we'll be able to access health services for free, it's likely that we'll just sit and wait to get sick and come, and get free services. I mean, so in terms of the preventive bit of it, I mean, what is contained under the UHC?
What I can say is the most important thing, and I would like to put it in terms of, because now we're focusing on a cost approach to healthcare. If you look at it in form of a pyramid,
yes,
majority of Kenyans or majority of any population within a country will always be healthy. The people who you'll find in the hospitals are comprised of very, very small segment compared to the majority who are healthy. Now, the biggest problem that we have is whenever...
the healthy ones are at the bottom, I presume.
They're the bottom. They're the bottom, exactly.
Okay.
They're the bottom, they're the majority.
Yes.
So the problem that we usually have is the moment we focus so much of our investment in the curative aspect, we tend to lose focus of the ones who are healthy. So, for example, let me talk about, for example, teenage pregnancies. How do we avoid that with a view to avoiding or to ensuring that the teenagers are able to really develop to their full potential, they are able to avoid communicable diseases such as HIV, sexually transmitted diseases, and so on. It is through health education, by empowering them when they're young and preventing them from getting to the next stage. And should they get to the next stage, they need to be tested, to be screened, to be screened for diseases such as HIV, for example. And should they now contract the disease, now they should be now on treatment. So that is really the hierarchy that we're supposed to adopt if we are to be able to adopt successfully or to implement UHC successfully. And this is what has happened in other countries that have successfully implemented it.
So are you also using the same approach in terms of trying to, lay more emphasis on the preventive bit of it as opposed to the curative stages?
Yes. Our real emphasis here is prevention, the community health volunteer, the mwananchi mashinani. We want them to know malaria. We want them to know how do you contract it, how do you prevent it, what is this special thing about the bed net that is preventing or is protecting me from the disease. Why do I have to use it all the time? Because it's something that you take for granted that people actually know is a given, but it's not. Pneumonia, how do you prevent it? Why do you have to keep getting so many vaccinations? And diarrheal disease, and so on and so forth. So many of these diseases can actually be prevented through education, health education. And that is why we're laying a lot of emphasis on the preventive and promotive. Promotive meaning promoting people to stay healthy.
Yes, promoting people to stay healthy. Right, let's finally, just look at the costs of, treatment in this country. And, based on what, the government is now bringing in the UHC, are we likely to see the cost of treatment going down, particularly, both in the private sector and in the public sector when we're talking about universal health coverage?
Yes, definitely. That I can assure you that given that we have really sat down and discussed extensively how we intend to go about this whole program, it is more or less assured that the cost of treatment or cost of healthcare is likely is more or less likely to, or assured to go down. And not just the cost of healthcare, but also the cost implications to the ordinary mwananchi. We see a lot of mwananchi doing harambees, selling a lot of their produce, the animals.
They actually sell everything just to pay their hospital bills.
Universal health coverage promises that you will not have to do that. The government is meant to come in and support. How the government is going to come in and actually implement and the assurance that the government is going to give us, we will hear from the president on Thursday. On Thursday.
Yes. All right, I'm informed our time is up, but I'll just give you 10 seconds to look into the camera and perhaps tell Kenyan people what they should expect with the universal health coverage, and particularly, just focus on the preventive aspect of it as opposed to the curative bit.
Okay. So Kenyans, my message to you as a doctor is really don't look at health as something that really requires you to invest in terms of spending money, but look at it as something that you can save by practicing healthy behaviors. We're talking about vaccination to prevent vaccine-preventable diseases such as pneumonia, diarrhea. We're talking about exercise, for example, to avoid obesity that is really causing a lot of heart disease and hypertension and so on. And a lot of really just focus more on how to prevent disease rather than how to really save on money to spend in the hospitals treating yourselves.
All right. Thank you very much. We appreciate you finding time to come and share with us what we should expect, because there was a lot of uncertainty on what really it means. Is it free? Is it, at some cost, and what does it mean? Well, that is Dr. Samson Mahugu, who is the head of health promotion at the Ministry of Health, just giving us some insights on what really it means when we talk about universal health coverage, especially for you and me. And of course, what he's saying is the government is trying to ensure that you access either free or a very reduced rates when it comes to getting treatment at public hospitals. We put a cap on your health, but Regina Manyara Getao is up next with the day's business.